If you are dealing with fungal skin infections like athlete's foot, jock itch, or ringworm, or a condition called pityriasis, tinea versicolor, that causes changes in skin color, Loprox suspension, topical may be the solution for you. This medication contains Ciclopirox, which is an antifungal medication that works by stopping the growth of fungus. The usual dosage for Loprox suspension, topical is to apply a thin layer to the affected area once daily, preferably at bedtime. It is important to continue using this medication for the full prescribed length of time, even if symptoms improve before then. Be sure to follow your doctor's instructions carefully for the best results. When using Loprox suspension, topical, it's important to only apply it to the skin. Make sure the area is clean and dry before applying the medication. Shake the bottle well and then apply a thin layer of the medication on and around the affected area, gently rubbing it into the skin as directed by your doctor. This is typically done twice a day. Remember to wash your hands after applying the medication, unless you are treating your hands. Avoid getting the medication in your eyes, nose, mouth, or inside the vagina. If this happens, rinse with plenty of water. For best results, use this medication at the same times each day. It's important to continue using the medication for the full time prescribed, even if your symptoms improve before then. Stopping the medication too early may cause the infection to return. You should start to see improvement in your condition within the first week of treatment. If you have pityriasis, tell your doctor if your condition worsens or does not improve after 2 weeks. For other fungal skin infections, let your doctor know if your condition does not improve after 4 weeks. Side effects of Loprox suspension, topical may include burning, redness, or itching at the application site. If these effects persist or worsen, notify your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, seek immediate medical attention if you experience blistering, swelling, or oozing at the application site, or if you notice symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects. Before using Loprox suspension, topical, it's important to discuss any allergies with your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions. Make sure to also inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, make sure to inform your doctors or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Loprox suspension, topical should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is currently unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. The recommended dosage and timing for using Loprox suspension, topical will depend on your specific condition. Make sure to follow your doctor's instructions and guidelines carefully. When using Loprox suspension, topical, it is important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Loprox suspension, topical. Always follow your doctor's guidance and recommendations for the best results. If someone accidentally swallows Loprox suspension, it can be harmful. If the person shows serious symptoms like passing out or having trouble breathing, it is important to call 911 right away. Otherwise, it's important to contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. For Canadian residents, they can call a provincial poison control center for assistance. Remember not to share this medication with others. Your doctor has prescribed this medication specifically for your current skin condition, so do not use it for any other skin infection without your doctor's approval. If you are treating athlete's foot, be sure to wear well-fitting, ventilated shoes and change your socks at least once a day. It's important to follow your doctor's instructions to ensure the best results. If you forget to use the Loprox suspension, topical, you can use it as soon as you remember. However, if it's almost time for your next dose, you should just skip the missed dose and continue with your regular schedule. It's important not to use a double dose to make up for the missed one. Make sure to store Loprox suspension, topical at room temperature to maintain its effectiveness. Keep it out of reach of children and pets to avoid any accidents. When you no longer need this medication or it has expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless you have been specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.